Very good morning to all of you. I am Dr. Mrinmai Kute, and today I'll present a rare case of Gyrate atrophy of choroid and retina. So Gyrate atrophy of choroid is a rare genetic disease of autosomal recessive inheritance. High prevalence is found in Finland, that is 1 in 50,000 cases. There is mutation of OAT gene on chromosome 10, which leads to deficiency of enzyme ornithine aminotransferase. There is 10 to 20-fold increase in plasma ornithine levels, and there are chorioretinal atrophic patches found in first decade with night blindness and myopia, and there is diminution of central vision due to macular affection and cataract found in second decade. So a 15-year-old male, Muslim by religion, born to consanguineous marriage, presented to our OPD with chief complaint of gradual diminution of vision in both eyes at night since childhood, and there was mild cognitive impairment and speech defect, and there was no family history of similar illness. On general examination, patient was conscious oriented. There was no pallor icterus, cyanosis, clubbing or lymphadenopathy, and rest vitals, all vitals were within normal limits. On systemic examination, CVS, RS and per abdomen were within normal limits, and on CNS, all cranial nerves were intact, and there was mild cognitive impairment and speech defect. On ocular examination, uncorrected visual acuity in both the eyes was 3 by 60, and best corrected visual acuity was 6 by 12 with minus 6 diopter spear add. Intraocular pressure was 12 millimeters of mercury. And slit lamp examination of anterior segment was within normal limits. On fundus examination, media was clear, cup disc ratio was 0.3, and there were patchy, sharply demarcated circular areas of chorioretinal atrophy with hyperpigmented margins in mid to far periphery with sparing of macula were found. To summarize with, a 15-year-old Muslim male born to consanguineous marriage presented with gradual diminution of vision at night since childhood, with past history of mild cognitive impairment and speech defect, and the positive findings of patchy, sharply demarcated circular areas of chorioretinal atrophy with hyperpigmented margins in mid to far periphery with macular sparing, we came to provisional diagnosis of Gyrate atrophy of choroid and retina. And we differentiated it from choroideremia, retinitis pigmentosa, pathological myopia, and Beatty crystalline dystrophy. And patient was advised further investigation, like on blood investigation, 20-fold rise in plasma ornithine level were found, and rest urine, serum electrolytes, and serology was within normal limits. On OCT, hyporeflective cystic spaces in inner retina were found, and on ERG, extinguished rod cone responses were recorded. We managed this case with eye drop dorzolamide 2%, 1 drop twice a day, tablet vitamin B6 40 mg twice daily for 6 months. Patient was advised arginine restricted diet, and parents were advised genetic testing. So what is unique in my case? That it is an autosomal recessive condition. There are markedly elevated plasma ornithine due to ornithine aminotransferase deficiency. There are well-defined scallop geographic areas of chorioretinal atrophy which begins in mid-periphery, which progressively enlarge and coalesce. So early recognition and metabolic intervention, that is diet and pyridoxine, they are essential to slow the retinal degeneration and preserve vision. So take home message is early diagnosis, dietary modifications, vitamin B6 and genetic counseling are effective in management and further progression of disease. Thank you.
Good one, Mrinmai, and I just want to know, did you do any, what do you call, counseling, found out that other members of the family, anybody is affected? You not mentioned that.
So there were no other members in family were affected. There was no family.
How many
history.
siblings?
No siblings.
Parents?
Sir. No sir, parents were not affected.
Okay, uncle, aunt, anybody?
No sir, no one in the family.
Nobody are affected. Because I have presented, published long time back in 1988, and entire family of Gyrate atrophy of choroid and retina, and they do pretty well with pyridoxine. Not pretty well means at least we can say. Anything you want to say, sir? Dr. Jain, sir? Anything you like to say? Yes. Gyrate atrophy of the choroid and retina is something which is because it runs in the family and
yes.
Autosomal recessive, as you rightly said.
Yes,
so no other member in the family. I'm a little surprised about it.
no sir.
Because I had a patient where a family wherein all the 3 siblings were affected, the mother was affected, and the grandfather or grandmother were affected. Whole family, we published that in, yes, Gyrate atrophy of the choroid and retina. Yeah. Absolutely.
Yes.
They have the pedigree chart. You need to do a counseling because the future is all. What is the age of the patient now?
So he was is 15 years old.
Because we have to make sure, because these people, they will go for when they are 20, 21 now, especially Muslim, they get married early. So we have to counsel them accordingly, because this is going to be propagated to the next generation as well. So the genetic counseling is very important. I'm sure you will be having some a lot of genetic counseling is going on now, and a lot of work is going on now on this field as well. And they are doing gene therapy, and so many other factors are coming into play. But something which is very, very necessary with genetic counseling, you need to counsel the entire family, that making sure that they don't, even if they get married, they should not get any children. That's what you have to tell them. So I think the genetic counselor, there are special in Chennai and other places also, so many other places, there are special ocular genetic counselors, only for the eye. And you can contact them, and online also they can do. Shop Eye Center they have. In Bangalore we have Dr. Rajini Bhattu, who is doing a lot of work on this. She's got her own thing, and she used to do come to Chennai to our center as well. Then we have Dr. Kumar Manikvel, who was formerly in Shankar Netralaya, now in Chennai. And a lot of work is being done on this field. Because genetic counseling is something which is very important, you should not neglect that. So anything you want to add, sir, for the Gyrate atrophy? Yes, sir.
Thank you, sir.
Thank you, thank you.